healthy teeth is far more than just a luxury. Healthy teeth is part of our smile, such an important part of our smile, and I think we all deserve to have healthy teeth, and we can have healthy teeth. There can be a lot of reasons why people choose not to take care of their teeth, and I would emphasize the point, it is about choice at the end of the day. We can choose whether we live a healthy life, or we can choose whether we live an unhealthy life. And let's face it, when we're thinking about our teeth, when we're thinking about dental diseases, we're thinking about decay, and decay is a lifestyle disease. We can all prevent decay happening in our teeth. And this is all around this whole concept of minimal intervention dentistry. Might be a new word, but it's something that there is good evidence shows and proves that teeth can be healthy for life. Caries is the word that dentists and their teams tend to use for decay. It's caused by sugar in any form, whether in food or drinks taken regularly, perhaps allied with not very effective cleaning, are going to make teeth liable to decay. But the thing is, we know that all decay is preventable if we just choose what we actually do to look after ourselves. Mm-hmm. I think when we're thinking about caring for our health, for many years there's perhaps been this notion that we go and see our doctor or go and see our dentist when we've got a problem. I think the big cultural shift that is happening now is that people are beginning to realize they have to take responsibility for their own health. We were talking about dental decay. That is a creation of each and every one of us, and we can choose whether we create dental disease or not. Now, with what we know about how to prevent dental disease, how we can prevent decay, if we work effectively with our dentist, there are all sorts of advantages. First of all, in the short term, it's going to be much easier, much more straightforward to work with your dentist so that teeth last a lifetime. Historically, many people thought about going to a dentist, and it would be a question would be were they going to have a filling or not, or almost expecting to have treatment. That has now changed. We're seeing this big cultural change. People are beginning to go to the dentist because they want to find out how they can stay healthy for the rest of their life. Patients are actually asking for what the profession knows as minimal intervention dentistry. Actually, what patients are beginning to say is, look, I've been born with healthy teeth. I want to keep my teeth healthy. The old saying, prevention is far better than cure. Yeah, I think we would all agree with that in whatever form of healthcare we're talking about. This can be a reality in dentistry. We know that with effective advice and individual patients taking responsibility for their mouths, perhaps in a way they hadn't really considered before, then they can stay healthy for the rest of their life and enjoy dental health and enjoy the smile and everything that it brings with it. When we think about the dental health of children's teeth in this country, there are a great number of kids growing up with really healthy teeth. However, dental decay is still very much affecting significant parts of the population. And that is really such a tragedy, because all that dental decay can be prevented. It is a question about helping families to understand about what they can do to help their own children grow up with healthy teeth. You see, when we're born, and in the first few years the teeth come into the mouth, they're healthy. Teeth don't grow into the mouth with dental decay in them. It's what happens when they are in the mouth. And this is where lifestyle plays such a huge and crucial role in whether teeth stay healthy or whether teeth develop decay. So by helping people to actually say, you know, we can take control of this. Yeah, it is a lifestyle disease. It is not something that happens like an infection like flu or something. It is something that we can prevent. You can't always prevent catching the common cold, but you can prevent whether you're going to get dental decay in your mouth. Prevention in dentistry has been around for a long time. The basic concept, if you like, that dental decay can be prevented, avoiding sugar and sugary drinks, that's been known for a while. What we are now seeing within the profession is that this whole concept has been bundled together into what we call minimal intervention dentistry. This is what's being taught to young dentists in dental school now. The other big difference is that with advances in technology, dentists can now provide for individual patients forms of treatment, preventive treatment. So this is not about fillings, this is about specific tooth coatings. This is about being able to analyze very simply patients' saliva to find out whether they're going to be more likely to get decay in their teeth than other people, or whether they're more likely to have gum disease. Dentists now have the tools, the armamentaria, in which they can then offer specific individual advice to patients that they know will benefit them. And if that advice is followed carefully, and it does require commitment from individual patients, what they do and what they choose to do on a day-to-day basis, then if that advice is followed carefully, those people know that they're going to grow up and carry on living and enjoying healthy teeth. Why do patients tend to wait until they've got problems with their teeth before going along to see their dentist? Well, if you think about it, we all know we should do things, but we don't always do it. How many times do we say after Christmas, I put on a few pounds and I really should start going to the gym? Wouldn't it have been better to go to the gym throughout that whole period of time? So I don't think this is something that's unique to dentistry. There may be an element, again, if we look back to when there was a lot of fear about going to the dentist, that can deter people, and sometimes that memory can last for a long time. But actually what we know now is that if you go along whilst you feel you are still healthy, then work with your dental team, work with your dentist to carry on enjoying health. I think the traditional concept of going to see a dentist was literally going to see one person. Whereas nowadays, in so many practices, the dentist actually leads a team of healthcare professionals. These dental healthcare professionals have specific roles to help those patients stay healthy. So for example, the practice may have a hygienist there who's going to specifically help people keep their gums healthy. The dentist may work with a dental therapist who is particularly trained to look after the particular needs of younger patients. With dentistry in the UK at the moment, what we are seeing is a quiet but really exciting revolutionary change. And I don't use that word lightly either. What we are now beginning to see is that whole realization that people can enjoy healthy teeth, healthy unrepaired, healthy whole teeth with healthy gums for their life. Because so much research has been done over a long period of time, we're now in a position, the dental profession is now in a position that they can actually identify at the very earliest stages of dental decay, early stages of gum disease, and what's even more exciting is identifying those people who may be at greater risk of getting cavities in their teeth or suffering from gum problems. Now, if you can identify the people who are at the greatest risk, what dentists can also do is put in place a bespoke individual home care package of exactly what they need to do, the type of fluoride toothpaste, the type of toothbrush, the ways in which they should be cleaning in between their teeth, making amendments to their diet as well, which plays such a crucial role in keeping our mouths healthy, as indeed it does keeping our whole bodies healthy. Putting those plans in place, people can stay healthy. Consumer awareness of what can be prevented when we're thinking about dental problems is still low. we very much want to get the message out that actually nobody has to put up with what can be a very traumatic experience with severe dental decay, or having to make choices between having a large filling or having a tooth extracted. Sometimes in harsh economic times, those decisions are being based on financial reasons rather than what actually might be the best health reason. Those sort of decisions, we can actually preempt all of that. We can say to people, look, work with your dentist, work with them, understand what's happening in your mouth, and increasingly people will find that the experience of going to see their dentist is changing. There is likely to be much more questioning about how you look after your mouth, the type of diet you enjoy, so that the dentist and the dental team can really understand the things that are going to make a significant difference to keeping your mouth healthy. When choosing a dentist, I believe it's very important to visit the practice and to understand their approach to individual patient care. In other words, ask them questions like, how do you help your patients stay healthy? What does the practice mean by prevention of gum disease and prevention of dental decay? These sort of questions are really useful to find out. NHS dentistry is set for another big change. The last big change was in 2006, and the government has now decided to pilot further big changes to the system. What is interesting in this is that they are piloting a concept called capitation. Now, Denplan 25 years ago developed the concept of capitation, which means in essence that patients pay a fixed amount of money each year, and that then means that their dental health, with very much a preventive focus, is provided for that fixed sum of money. Dental capitation is in essence a maintenance contract. It's a bit like the maintenance contract you might have on your central heating system at home. A patient will pay a fixed sum per month, and in exchange for that fixed sum, the dentist and the dental team will work with the patient to keep them dentally healthy. So it will cover all their necessary dental needs to keep them nice and healthy. The concept behind capitation is very much that prevention is better than cure. It's about preventing disease, and by disease we mean dental decay and gum disease. It's about preventing this before it happens, because by preventing it, it's actually much cheaper than trying to cure the ravaging effects of decay or the ravaging effects of gum disease, where people lose teeth, can lose sleep through discomfort. All those things that can have a huge impact on people's lifestyle are preventable. So with a capitation plan in place, your dentist can work for a known cost, and I think known cost is very critical at the moment. We all know that we're in very harsh economic times. We all have to watch our budgets very closely, and by being able to budget for our dental care, with the emphasis being on prevention, surely that's a healthy recipe for the future. Some people have the concept that dentistry is expensive, and indeed to have technical, complex dentistry done, for example, crowns or large fillings, then quite appreciable sums of money can be involved. Now, wouldn't it be better to have a system in place where you're never going to need those expensive bits of dentistry or those high value bits of dentistry? Wouldn't it be better to prevent all that happening in the first place? And this is where minimal intervention comes in. It is literally that. It's about doing less to teeth, but doing more to keep teeth healthy. And the other huge advantage of that is that it's much more cost effective in the long term. Minimal intervention, if you like, means there is a lot less intervention into your wallet. The NHS dental system came into being along with the rest of the NHS in 1948. Over the years, a lot of the focus has been on treating problems, and very effectively treating problems as well. However, in the last 60 odd years, there's been a huge increase in our understanding of how dental problems can be prevented. With the current changes that are envisaged for the NHS, there is going to be, from what we understand, a greater emphasis on prevention. And that is certainly something to be welcomed. Denplan has been working in this preventive market for the last 25 years, has brought in the concept into this country of dental capitation, where patients pay a fixed fee so that they can be kept healthy. It's not about treating disease, it's not about treating decay or treating gum disease. It's about working with people to prevent that gum disease, prevent that decay happening in the first place. Dental decay is one of the commonest diseases in the Western world. How often do we think when we go along to the dentist, oh, am I going to have a filling done this time, or have I got away with it? Now, the reality is that it shouldn't be a matter of chance as it's seen by the individual. There are things that people can do to prevent decay happening, and a lot of this is about lifestyle. We all know that the various things we shouldn't do. For example, smoking is bad for our health. And the same general principle applies when we think about our mouths as well. There are certain things that are bad for our dental health. That's not to say that we have to ban sugars completely, but frequent intake of sugars in foods or sugary drinks, are going to increase the risk of whether we have to have the next filling or not. By adopting a healthy lifestyle, a good diet, and seeing a dentist regularly for specific advice about what we need to do to stay healthy, then the chance of that next filling happening can be almost eliminated. I think everybody would love to have a healthy, pleasing smile and to know that their mouth has got no decay in it and their gums are healthy. But what is even more important is that good dental health has a direct effect on the health of our bodies overall. There is research emerging that there is a link between such big diseases as heart disease, as stroke, as diabetes, and the health of our mouth. What we can now say is that the healthier our mouths are, the more likely we are to have a healthy body. So it's very much a question of a healthy mouth and a healthy body. The health of children's teeth in this country has improved dramatically over the last 20 or 30 years. However, having said that, there are still some children who suffer, and really suffer, with dental problems, principally dental decay. When children do get dental decay, they can get abscesses, they can get sleepless nights, they may well need to have teeth extracted as well. And this is still going on in dental practices and in dental hospitals every day of the year. Children are having to be admitted to be seen where the teeth are so broken down that the only thing that can be done is to have those teeth extracted. And that, I believe, is a huge shame. It's an enormous shame, and it's something that we as a country should carry responsibility for. We are a developed country, and yet there's still children really suffering with dental problems. When we think about these dental problems, though, this level of dental decay can be prevented. It is a question of families taking responsibility for their children's decay. This is a question of families taking responsibility for their children's dental health. Because the old saying is, you are what you eat, and if you have a lot of sugary, sweet things in your diet, then the consequences of that are decay. Equally, we have the choice as to whether we want to help our children grow up with healthy teeth. And they can grow up with healthy teeth. With the right knowledge, with working with dentists and their dental teams from a young age, involving the parents and the carers of these children, they don't need to face a future of dental problems, but they can look forward to dental health. There have been a lot of recent developments in some of the technologies dentists can use to help patients keep their mouths healthy. I'm thinking here, for example, of a product called tooth mousse, which is a coating that can be put onto teeth that helps to strengthen the surface, or helps it what we call remineralize. There's another product that's just been introduced literally in the last month in this country called Provora, which is a tooth coating that can be applied particularly to the roots of the teeth in perhaps in older people where the gums have shrunk back through previous problems, to help protect those areas of the tooth and reduce the likelihood of decay happening there in those teeth. The other area that's been a lot of advances in the science and research that's been going on is what we can tell from understanding people's saliva. If we sample and analyze saliva, we can get a good indication of whether people are likely to be, or more likely to be, prone to tooth decay or gum disease than other people. So the science that underpins what dentists do in their practice is giving dentists the tools to work with their patients to keep them healthy, and everybody wins. Dental decay is an incredibly common disease in this country. I think most of us will have experienced at some point in our life having had a filling. Now, if you think about it, teeth are born, when they first come through into the mouth, the tooth is healthy. But once decay starts and goes to an appreciable depth into the tooth, then a filling has to be placed. And as soon as you've placed a filling in a tooth, you've condemned that tooth to a life cycle throughout that person's life of having that filling replaced. Nothing lasts forever. And each time it's replaced, the filling might get slightly larger. So as soon as you've had a filling, it's not just that you've had that one filling. That filling will need replacing maybe every few years or longer, but it's unlikely to last for the rest of your life. Now, it'd be far better to think, how can this decay be prevented? So the need for that first filling in that tooth and that subsequent replacement of that filling over the years into the future, how can that be prevented? Well, the frustrating thing is that we know that decay can be prevented in teeth, and yet there are still people going to the dentist. They may not be aware that they have problems, but they have decay in their teeth where something has to be done to stop that decay progressing further. And yet, the sooner we can catch that decay, the more likely it is that we can actually prevent the need for filling in the first place. What's interesting with dental decay is that at the very earliest stages of the disease, before it's formed into an appreciable hole into the tooth, that can actually be stopped. With the right specific advice to that person, it doesn't necessarily mean that as soon as decay starts, then a filling has to be placed. When the decay has gone a long way, yes, a filling will have to be placed. But if it can be caught early and the correct, what we call prevention put in place, the decay can be stopped. And this is the whole cultural shift behind minimal intervention. This is about getting to problems before they have become problems that require either fillings or significant amounts of dentistry being done. Capitation as a concept for paying for dental care was developed by Denplan 25 years ago. It's been shown to be an effective way of helping patients keep their mouth healthy with the minimum amount of treatment being done, but the maximum amount of health gain. What is interesting at the moment is that the NHS is piloting this concept of capitation within the health service, and it will be interesting to see how this evolves and what degree of complexity dentists will be faced with to operate this system. Denplan are actively supporting and promoting minimal intervention for the benefit of all good dentists and for the benefit of patients. It is a concept that has good scientific evidence behind it that can help patients keep their mouths healthy for the rest of their life. Denplan wants to work with the profession in a way that this big cultural shift towards health, towards people taking responsibility for their own dental health, is for the benefit directly of patients. Minimal intervention really is about a dentist and a patient working very closely together. And the patient will need to come along quite regularly to ensure that the preventive strategies and programs put in place are really working. Now, of course, the important thing to realise, particularly at the moment in harsh economic times, is how that is going to be funded, because every appointment could cost money. But the best way to fund that is through a system known as capitation, which means that a patient will pay a fixed amount per month, and they know that these visits for the bespoke preventive advice, the cost of all that is known and is all covered. In tough economic times, we all have to watch our budgets very carefully. With dentistry, this is one area where we know that we can control our budget and what our budget is likely to be in the future. And the secret to this is all around prevention, because whichever way you think about it, as soon as you start to have a lot of dentistry done in your mouth, you start to have fillings or complex dentistry, then there's the cost of having that done, and there's the cost of having that serviced routinely. So the way for families to think about controlling the cost of their dentistry is to think about this concept of maintaining health. And this starts from the very youngest children, and if families can embrace this, then the family budget can be controlled as well. I think advice about keeping teeth healthy really starts with pregnant mums. Even at that point, they will be enormously excited about the birth of their child and are very receptive to advice about how they can grow up healthy, because there's no reason why children can't grow up with healthy teeth. So then is the time to start. And then when the children are born, to think from a very young age, working with all the family, working with the extended family as well, to help children grow up with healthy teeth. Because the science is there. We know the evidence. We know what works. We know that with good lifestyle, good diet, a sensible approach to looking after our teeth and seeing a dentist regularly, dental disease can be a thing of the past, and it's in our control as individuals whether we choose to rise to that challenge and take responsibility for our own dental health or not. Dentistry in the UK is undergoing a quiet yet highly significant and very exciting cultural shift. It really is a revolution. Gone are the days of thinking about treating dental problems. Gone are the days about purely thinking about fillings or extraction. What is happening now is that people are waking up to the notion that all of us can enjoy dental health for the rest of our lives. Whether we're a very young child or somebody in the latter years, we can enjoy dental health. There is the scientific evidence available, so dentists and their teams can help patients enjoy that. This is this silent revolution that is going to be so significant and is so exciting towards what the future will hold. It does rely, though, on individual patients working with their dentist to keep healthy and taking responsibility for their own dental health.